Hello, my name is Phil Owen and I'm with Communities for Recovery. I'm with the Targeted Response team there, and today on our show we have Michael Silva and Marlene Buchanan from Integral Care. And if you guys could introduce yourself, I guess Marlene, if you would go first, and then Michael, if you could introduce yourself and let us know about the departments that we're going to talk about today.
Sure. Thank you for having us. So my name is Marlene Buchanan. I am the practice administrator overseeing substance use services with Integral Care. So I oversee all of our HHSC substance use contracts and several other substance use services within the agency.
Great.
Hello, my name is Michael Silva. I am the team lead at Integral Care's Narcotic Treatment Program. Kind of a short synopsis of what we do at our program is, so we are considered a medication-assisted therapy program. So the services that we provide are primarily for people who are addicted to opioids, such as heroin or pain medications like hydrocodone and stuff like that. Like I said, we're medication assisted, so we use methadone, and we also use Subutex for our clients.
Okay, very good. Well, typically pre-COVID-19, how would services typically take place? Because my understanding is, I'm somewhat familiar with your programs, is that there's a methadone clinic, and then there's the OBOTs that use Subutex, or also people may know it by Suboxone. So I guess what I would want to know is, how did people hook up with services then? And then kind of now that the landscape has changed, what barriers or challenges are you guys faced with, and kind of how you're adapting to those and what that looks like?
Sure. So for everyone who is interested in our program, a good point to bring us, they can always call the agency's helpline, the 512-472-4357. And they can always ask that they would like to have an appointment for our narcotic treatment program. We do have to operate off of a waiting list, primarily because we are only funded to have a certain amount of clients in our program at one time. That is what our license says. So unfortunately, we have to operate off of a waiting list. However, we do our best to move people along as quickly as possible. So we are actively involved in trying to get in contact with the people who have made appointments so that we can potentially get them into services faster than the intake date that they are given. As far as some of the other programs, we do have an outpatient detox, and we do have an OBOT program that is available to clients who feel like that might be a more appropriate level of care for them. And once again, if people are interested in doing more of a Suboxone medication program, we can always either refer them to that, or they can call the 512-472-4357 number for assistance.
Okay, so if I was a person struggling with opiate use and I wanted to get attached to services, I have no idea what the medications are about, but I do have your helpline. So I call 512-472-HELP, correct? And how will I know what service to connect with? Is there assessment that is done? And how's the determination about what medication might be right for me determined?
Oh, that's a good question. We're going to talk with Will Terry from the Recovery Navigation Services team, I think sometime next week.
Yes.
And that is our substance use intake program, our internal substance use intake program. We accept internal and external referrals. So if someone calls and says, I need help, I don't know what to do, they're typically connected to Will Terry's team, which is the Recovery Navigation Services team. And that's a substance use intake team. And that team will link and refer clients to the appropriate treatment. So they would see someone on that team, have an assessment, and then if it's determined that their best fit might be the methadone clinic, then they would be referred over there. If it might be residential inpatient services, they are referred to some of our partners that we work with. So we do from Will Terry's team, we do referrals within integral care, but then we also do the majority of our referrals are outside of integral care to either sober living or inpatient detox, inpatient residential, and then also Michael's team, the Narcotic Treatment Program team over there on East 2nd.
Right. So it is the considerations are a whole care team. It's you're not just getting sent to one agency and then go do your own thing. So if I was so I do know if methadone is a daily program, or typically a daily program where I would show up for my medication, has that changed since COVID-19 situation has started up?
Yeah, it has. And under normal circumstances, when someone starts our program, they do come to our the clinic daily for their medication. But as the longer they're in treatment, considering the progress that they've made in treatment, such as keeping appointments, leaving clean drug screens, things along those lines, they can achieve take-homes so where they don't have to come to the clinic every day. Now, of course, with everything that's going on right now with COVID-19, some of those strategies have changed. Within the past maybe 3 weeks, probably now, I guess, we've been in contact with SAMHSA, with HSSC for guidance, and they have generously given clinics such as ours the ability to provide more take-homes to clients. So it could potentially limit, any type of exposure, from the traveling to being in and out of the clinic, things of that nature. So we've been really fortunate that we've been able to do that, in part thanks to SAMHSA and HSSC.
Okay. And typically with the OBOT or the Subutex program, clients or patients are able to take home, they're able to pick up a prescription at the central pharmacy or something to that effect, correct?
Correct. So with our OBOT program, clients typically pick up a prescription. And so we've continued that process where they are doing 28-day now prescriptions for most individuals. And so they don't have to come into the clinic post, in this COVID-19 world, they don't have to come into the clinic as often. We're also able to do some telehealth options for individuals that do need to come into the clinic. We can utilize Teams, which is a PHI-friendly, protected health information-friendly platform where we're able to telemed with individuals and then send their prescriptions to pharmacies such as HEB, which has drive-throughs, so individuals don't have to go into the store to get their prescriptions either.
Okay. Now, I know with medication-assisted treatment, it's not just medication, right? There are other supports that are in place to help somebody along with the medication. And could you tell me what those other supports are and how those supports are being handled with Integral Care at the moment?
Sure. So every client in our program has their own caseworker that they see. So under, again, normal circumstances, they have scheduled appointments, and in those appointments we talk about their treatment there, how they're doing on their medications, if there's any adjustments that need to be done. We also do provide any type of referrals that they may be looking for, provide referrals such as for housing, for unemployment, food banks, things of that nature. So typically, under normal circumstances, that's what we do. Under the umbrella we're working with now with COVID-19, we are still providing those type of services. However, those services are mainly being done over the telephone. So right now, our caseworkers are reaching out to their clients to continue those scheduled appointments so we can provide support with everything that's going on in the world right now in our community and stuff like that. We are trying our best to reach out to our clients so that they can have that support and they have that that line to where they can talk about their stressors, their anxiety that's going on right now. And we feel that's really important.
And are you seeing that everything? I'm assuming that it would just make sense that those supports are needed at a heightened level. And the reason why I say that is I think everybody even those that maybe not struggling as much as others are kind of at anxiety levels are all a little heightened at the moment? Are you guys experiencing that? Is that a noticeable thing currently?
I would say so, yeah. In the conversations that I've had with some of my clients, yeah, that stress, those stressors are definitely out there. For some of them, they have jobs and they don't know what's going to become of those, after another week or 2 or 3. Some of them just don't have, no idea what they're doing as far as what's going to happen next, or how are they going to be able to pay for rent, things of that nature. So yeah, their stressors are high, and so we're doing our best to provide that support for them, and hopefully maybe try to minimize some of the stressors and just make ourselves available as much as we can.
Right. I know that finances are a big concern right now. A lot of people are losing jobs and so forth. So that brings me to the question about funding. How are services funded at Integral Care? If I was to enter, I called the helpline, 512-472-HELP, and I've got an issue with opiates. I really need problems, but I have no insurance. Where do we go from there?
So we have several, we work with HHSC, and we are given several indigent contracts which cover funds for individuals that don't have insurance and meet a certain poverty guideline. We also accept for individuals that have insurance. We accept Medicare, we accept Medicaid, we accept private insurance. So any kind of insurance funding stream we're able to accept, and then we have our indigent slots as well for individuals with no insurance.
Okay, so hope it's not all lost. There are funding alternatives.
Yeah.
The other thing I wanted to ask was, you had mentioned that there were a capacity that you reach with regards to medication-assisted treatment. When that capacity is and you're full, what happens to the people that are on the waiting list? Are there other places you can send them? How do we give these people some hope while they're waiting? And if you could just kind of approximate, what does that wait usually look like?
So the wait varies for sure, but we do have some alternatives, and I'll let Michael talk a little bit more about what NTP does specifically. But we do partner with CMS, which is another provider in the region, and we're able to send some individuals over through something that we call gap funding, which is a bucket of money that we have that our utilization management group oversees the spending. And we can actually pay for individuals to begin methadone at CMS and then transition back to us, so they aren't waiting on the wait list the whole time with no services. If people are on the wait list, we have a caseworker that reaches out to them weekly. And Michael, you want to talk about what that looks like?
Yeah, so we do have some caseworkers who reach out to those clients who are on the wait list, like Marlene said, weekly, so that we can just continue to be in contact with them, just to continue to see if there's any other type of services that we can refer them to, see if they're still interested in our program as well. So we are definitely in constant contact with everybody who is on our wait list, so that we can make sure that whenever their date comes, we can give them a call, or if we move their appointment up, which does happen periodically, we can say, hey, we have an earlier day and time for you. So that kind of helps provide a little bit of hope for them, so they don't necessarily have to wait, months. There is that hope that they can get in a lot sooner.
We also refer individuals with a mental health diagnosis or a suspected mental health diagnosis over to our COPS D program, which we talked to Jessica Sharib about earlier today. And that program is able to do in-home visits for individuals that have a co-occurring psychiatric and substance use diagnosis. And so they can, on top of having weekly contact with Michael's team, they can also have some case management support in the field from the COPS D team as well.
Okay, great. And so if the capacity is reached for medication, if somebody that's on that wait list, are they able to connect with counseling services yet? Or do they have to wait and enter the program for services at the same time?
They're able to connect with counseling services, so they can go through any of our clinics to connect with counseling services, and or they can connect with Jessica Jessica's team, the Cops Deep team, where they have LCDCs on the team, so they can do some substance use counseling there as well.
Okay, and just to be clear, when somebody makes that phone call to your helpline and they get assessed, they're assigned to a caseworker or somebody is going to help guide them through this process. They don't need to know all these departments that we're talking about today. They're going to get some help. They're going to have a tour guide, if you will, to explain what options are out there for them.
Yes, of course. Yes, it's a lot. So that's our goal, is to have someone can just call and say, I need help. And we navigate the system because it is confusing and there's lots of different programs. So we kind of walk them through, or tour guide, I like that, tour guide them through the system to find the appropriate services for them.
Sure. Okay. I'd also like to know if you guys envision a change in the way services are delivered when we finally come out of this thing, whenever that may be. Do you think we're going to get a hybrid system? Are things going to change one way or another? Are we going to merge services and it's going to look a little bit like the way it was before and like the way it is now? Or do you have any thoughts on that?
So I think that's a great question. I think with our narcotic treatment program, the DEA and our SAMHSA and HHSC guidelines are pretty specific on what services need to look like, including the amount of face-to-face time and how often an individual is seen. For an example, individuals who first come into the program are required to be seen daily for the first 6 months of being in the program. So I don't see a lot changing in particular for NTP, but it has given us a unique opportunity to learn how to use telephonic services and telemedicine and telehealth. And so if we were ever in a catastrophe state again, we would definitely have more guidance on what to do in the future. But I don't see our NTP services changing from what they originally were pre-COVID-19.
Right. Well, I know Governor Cuomo had mentioned that the healthcare system needed to function more as one single organism rather than a bunch of individual organisms. And it seems like Integral Care already does a really good job at that. So it does seem like you guys have a grip on, you already kind of function in the way that some others are going to have to adapt to coming out of this. Is there anything else that you'd like to say? I do want to repeat one more time. The helpline is 512-472-HELP. And the website is?
www.integralcare.org. And I just want to say that our clinics are still open. We have consolidated services down to our East 2nd Street location, but we still have individuals there that can see individuals face-to-face and or telephonically. The best way to get an appointment for services is to call the 472 helpline. If someone is in a psychiatric crisis, our psychiatric emergency services is still open with same-day appointment availability. And the best way to connect with them is also to call the 472 HELP.
Okay, with regards to psychiatric emergency services, are people able to show up there like they have been able to in the past?
So our doors are not open at the time for walk-in appointments. However, if someone does show up, that we can get them a same-day appointment. And or they can call 472 HELP as well.
So in a crisis, psychiatric emergency services.
Yes.
Okay, great. Well, thank you guys so much for being on. Marlene, you answered this for me earlier, so I'm just going to ask you what your favorite flavor of ice cream is.
Oh, goodness. So earlier I said that I like a Blizzard. So I would say a Heath Bar Blizzard from Dairy Queen.
Awesome. Michael, I'm going to ask you a slightly different question. If you're able to create your own flavor of ice cream, what would that be?
All right, so I've thought about it a little bit. So the first thing kind of popped into my mind was I'm a big fan of I think there's the Skittles jelly beans. So something around those lines of a Skittles jelly bean ice cream would probably be magnificent for me.
Okay. Great. Well, hey, thank you both for being on here. We really appreciate it. And once again, that Integral Care helpline is 512-472-HELP. Thank you guys so much.
Thanks, Phil.
Thanks, Phil.